This is CY, 55-year-old male. He has agreed to do this homework assignment and be assessed. His only medical history is he has a history of high blood pressure, which he takes losartan 100 milligrams daily for. Family history, he has a history of hypertension, chronic heart failure, and other heart-related diseases. He's never been admitted to the hospital for any type of heart problem, he's never had any chest pain, never had any real issues with his blood pressure being high ever since he started taking medication for it. Doesn't smoke, no drinking, he does chew tobacco. So my main teaching point with him would be diet and exercise, so limit his sodium intake, not eat processed foods, no lunch meat, try to avoid canned foods and food high in salt. He could do fresh fruits, fresh vegetables, and as much fresh meat and food as he can. And then I would also encourage daily activities, so get out and take a walk every day and try to stay active, maybe go to the gym, things like that. So now I will start the assessment. I already took his blood pressure and pulse. His blood pressure was 127/80 and his heart rate was 72. So now I would just look and note for the color of his skin. It looks good in pink, warm, dry. He doesn't look pale, so his blood must be perfusing well. I would look at his face for any type of swelling, which I don't see any. Okay, and then I will look at hold his head back, look at his veins. I don't notice any distension in his jugular veins. His carotid veins, their arteries look fine. I don't notice any pulsations or any beating out of the ordinary. In a typical assessment, you would want him to wear a gown, but for now, I don't notice any abnormal beating in his chest or anything like that. I would look at his hands for swelling, check his pulses, make sure they both feel regular and equal with each other, which they do. Then I would take a look at his legs and note if he has any swelling, which it doesn't look like it. Then I would check for a pedal pulse, which he has, which means that's good. The blood is perfusing to his legs. So I did inspection and then felt for pulses in a couple places. Now I would feel his jugular veins and carotid arteries for pulses, which are both palpable. And then they feel fine. Then I would just go over his chest, look for any pulsations out of the normal or any very heaviness, which I don't feel anything, so that's good. And then feel his stomach for any beating, which I don't feel. So good. I would note his breathing. It's unlabored, regular, so he's not having any difficulties with that. He's not having any shortness of breath or anything, which means he's not fluid overload. So then next, I would take a listen to his heart, and I would go over the 5 points. And then I already took an apical pulse, but you would listen right here for that and check that. Like I said, it was 72. So I was listening to hear S1, S2 sounds, which I hear. I don't hear any bruits, any extra heart sounds. It sounds fine. His rate is regular. It's not fast. It's not irregular. He's having a normal rhythm. Then I would listen over I could listen to his carotid artery, listen to this and feel at the same time, check that. It's good. So, yep, that would complete this cardiac assessment.